5 medical tests seniors over 70 should rethink: what you really need and what to skip. 5 medical tests seniors in the US should think twice about after turning 70, scientific evidence you need to know. In the United States, older adults are constantly told that routine screenings and regular checkups are the key to staying healthy. It's a message deeply ingrained in American healthcare culture. The earlier, the better. Catching it early saves lives. Don't skip your annual screenings. But what if this well-meaning advice doesn't always apply, especially after age 70? Today, a growing number of physicians, public health experts, and peer-reviewed studies are challenging the one-size-fits-all approach to preventive testing in older adults. The data shows that for many healthy seniors, certain routine medical exams may no longer offer meaningful benefits, and in some cases, they can cause physical, emotional, and financial harm. The truth: more testing doesn't always mean better care. If you're over 70, or if you're helping care for aging parents or loved ones, it's time to ask a critical question. Are all these medical tests still necessary? The answer isn't always. In fact, continuing certain screenings past a certain age may result in false positives and unnecessary anxiety, invasive procedures and follow-up surgeries, over-medication and long-term side effects, rising out-of-pocket costs not always covered by Medicare, no measurable increase in lifespan or quality of life. That's why it's so important to separate truly essential screenings from those that may no longer serve a purpose, and could even backfire. In this science-backed guide, we break down 5 medical tests seniors in the US should carefully reconsider after age 70. If you're an older adult, or advocate for someone who is, this could help you avoid unnecessary procedures, save money, and protect your health. Why full-body CT scans are risky for Americans over 70, what you need to know before booking one. Full-body CT scans are frequently marketed in the United States as premium preventive health checks, often included in executive physicals or elite health screening packages at private clinics. Many Americans see these scans as a way to catch serious health problems early and take control of their well-being. However, the reality is far more complicated and concerning. Full-body CT scans expose patients to very high doses of ionizing radiation, significantly more than standard X-rays. According to a 2023 study published in JAMA Internal Medicine, the cumulative radiation from CT scans may contribute to up to 5% of all cancers diagnosed annually in the US. This cancer risk is roughly equivalent to the risk from daily alcohol consumption, highlighting the serious long-term danger. Beyond the radiation risk, full-body CT scans frequently identify benign abnormalities such as harmless nodules, cysts, or calcifications, especially common in older adults. Unfortunately, these findings often trigger a chain reaction of unnecessary medical interventions, including further imaging tests, invasive biopsies, and even surgeries, all carrying their own risks of complications, costs, and emotional stress. For healthy seniors over 70 without symptoms, there is no scientific evidence that routine full-body CT scans improve survival rates or enhance quality of life. In fact, experts including the American College of Radiology strongly advise against the use of full-body CT scans as general screening tools in asymptomatic adults due to these risks. What should Americans do instead? If you're over 70 and concerned about your health, focus on proven strategies for healthy aging rather than high-risk screenings. Maintain a balanced diet rich in fruits, vegetables, and whole grain. Stay physically active with regular exercise tailored to your ability. Manage chronic conditions with your healthcare provider's guidance. Get age-appropriate screenings recommended by your doctor, such as mammograms, colon cancer screening, or heart health evaluations. Discuss any symptoms like unexplained weight loss, persistent pain, or bleeding with your physician for targeted diagnostic testing rather than broad, high-risk scans. Take control of your health wisely. Before scheduling a full-body CT scan, ask yourself, is this scan necessary based on my current symptoms or risk factors? Will the scan result change my treatment plan or improve my health outcomes? Am I aware of the radiation risks involved? If the answer is no or you're unsure, consider consulting a trusted healthcare professional for a personalized evaluation. Avoid unnecessary radiation exposure that could increase your cancer risk and lead to potentially harmful medical procedures. Your health is your most valuable asset. Protect it with smart decisions, not unnecessary tests. Colonoscopy after age 75, why seniors should reconsider routine screening. Colonoscopy remains the gold standard for colorectal cancer screening in the United States, helping save thousands of lives each year by detecting precancerous polyps and early-stage cancer. However, for Americans aged 75 and older, the benefits of routine colonoscopy decline sharply, especially if previous screenings were normal. At this age, the potential harms and risks often outweigh the benefits, making it crucial to carefully evaluate whether this invasive procedure is right for you. Risks of colonoscopy in seniors over 75. Undergoing a colonoscopy after age 75 involves several serious considerations. The laxatives used to clean out your colon can cause dehydration and electrolyte imbalances, which can be particularly dangerous for older adults with underlying health issues. Sedation during the procedure increases the risk of postoperative cognitive decline, delirium, and prolonged recovery times in seniors. Seniors face an increased risk of complications such as bleeding, infection, and even colon perforation. These complications often require hospitalization and may lead to long-term health consequences. A landmark 2019 study analyzing over 1.3 million Medicare beneficiaries found that for every 1,000 colonoscopies performed in adults over 75, only 2 lives were saved, while more than 20 patients experienced serious adverse events. This data highlights the delicate balance between potential life-saving benefits and real risks in elderly populations. What are safer alternatives to colonoscopy? If you are over 75 and have had regular normal colonoscopy results in the past, you may want to discuss alternative screening options with your healthcare provider. Fecal immunochemical test. This stool-based test is non-invasive, can be done comfortably at home, and does not require bowel prep or sedation. It detects hidden blood in the stool, a common early sign of colorectal cancer. Stool DNA testing, another at-home option that analyzes DNA markers in stool samples, offering high sensitivity for detecting cancer and precancerous lesions without the risks of invasive procedures. Talk to your doctor today. If you're an American senior over 75, don't agree to routine colonoscopy without fully understanding the risks and benefits. Make an informed decision by discussing your personal health history, previous screening results, and risk factors with your doctor. Ask about non-invasive screening tests like the FIT or stool DNA tests, which offer safer, effective alternatives for colorectal cancer detection in older adults. Prioritize your health and quality of life by choosing screening methods that fit your unique needs. Remember, your age, overall health, and screening history matter. Colonoscopy after 75 is not a one-size-fits-all solution. Stay informed, stay proactive, and partner with your healthcare provider to make the best choice for your longevity and well-being. While this test is commonly used to detect heart problems, many older adults in the U.S. without clear symptoms of heart disease may face more risks than benefits from this procedure. Cardiac stress tests without symptoms can do more harm than good. Research shows that in adults over 70 who don't have classic heart disease symptoms, like chest pain during exercise or shortness of breath, the false positive rate for stress tests can be as high as 40%. This means nearly half of these tests may incorrectly indicate a heart problem when there isn't one. These false positives often lead to follow-up procedures such as angiograms, stent placements, or even bypass surgeries. Unfortunately, studies confirm that these invasive interventions do not improve survival rates or quality of life in asymptomatic seniors. Worse yet, these procedures come with significant risks, including bleeding complications, kidney damage from contrast dyes, and extended hospital stays. For many seniors, these side effects can result in a decline in independence and overall health. Safer and smarter alternatives to stress testing for seniors. If you don't have obvious signs of heart disease, it's important to discuss safer, more effective diagnostic options with your doctor. Resting electrocardiogram, a quick, non-invasive test that measures your heart's electrical activity while at rest. Coronary calcium scan, a low-radiation CT scan that detects calcium buildup in your arteries, helping assess your risk of heart disease without invasive procedure. These tests have a lower risk of complications and often provide clearer information to guide your healthcare decisions. Take control of your heart health, ask the right questions. If you're a senior American concerned about your heart health, don't automatically agree to a cardiac stress test. Before proceeding, ask your healthcare provider. Do I have any clear symptoms of heart disease that justify this test? What are the risks associated with the cardiac stress test in my age group? Are there safer alternatives better suited for me? Your health is your most valuable asset. Make informed decisions by focusing on evidence-based medicine and personalized care. Remember, true heart disease prevention after 70 isn't about routine stress testing. It's about smart, individualized medical guidance and lifestyle choices. It's common for family members and seniors themselves to worry about early signs of dementia or Alzheimer's disease. Because of this, Doctors often order brain MRI scans to check everything to catch problems early. However, the reality is more complex. Research published in Neurology Today in 2021 highlights that 97% of older adults who received brain MRIs due to mild cognitive complaints showed no treatable abnormalities. Most findings on these scans, such as white matter hyperintensities, small spots, or slight brain shrinkage, are actually normal age-related changes and do not mean dementia or any serious neurological condition. Unfortunately, these normal findings often cause unnecessary anxiety and lead to more invasive follow-up tests like lumbar punctures, spinal taps, expensive PET scans, or even brain biopsies. These procedures come with their own risks, including infection, bleeding, and increased stress. If you or a loved one in the US over 70 are experiencing mild memory issues, here's what to do instead. Start with a simple cognitive screening test during your primary care visit. Tools like the Mini Mental State Exam or Montreal Cognitive Assessment provide reliable, low-risk ways to evaluate brain function. Focus on proven lifestyle strategies to support brain health, prioritize quality sleep, stay well hydrated, engage in regular physical exercise, and challenge your brain with puzzles, reading, or social activities. Talk openly with your healthcare provider about your symptoms and concerns. Ask if brain MRI is truly necessary or if monitoring over time with lifestyle adjustments is the safer, more effective route. Don't rush into expensive and potentially harmful imaging just because memory lapses worry you. Early detection is important, but so is avoiding unnecessary tests that don't improve your health and may even cause harm. Take control of your cognitive health today by choosing smarter, evidence-based steps. Contact your primary care physician to schedule a cognitive screening, and commit to lifestyle habits that help keep your mind sharp for years to come. 5. Why routine bone density scans after 70 may be doing more harm than good. In the United States, bone density tests are widely used to screen for osteoporosis, particularly among postmenopausal women and older adults. But here's what many Americans over 70 aren't being told: even in healthy seniors with no history of fractures or falls, these scans almost always show some degree of bone loss, not because of disease, but simply due to normal aging. This often leads to a troubling cycle. A scan shows osteopenia or mild osteoporosis. The patient is prescribed medications like bisphosphonates. The drugs trigger dangerous side effects, without significantly reducing fracture risk. According to a major study published in the Journal of the American Geriatric Society, treating age-related bone loss in women over 70 with prescription drugs had little to no impact on preventing future fractures. In fact, the side effects of these medications, including osteonecrosis of the jaw, esophageal damage, and atypical femur fractures, can be far more dangerous than the bone thinning itself. What doctors often don't mention: low bone density doesn't always mean high fracture risk. Bone quality, muscle strength, balance, and fall frequency matter just as much, if not more, than a scan result. Most fractures in older adults occur from falls, not from silently deteriorating bones. Many seniors are labeled as high risk and placed on medications for life, when no treatment was needed in the first place. A smarter, safer approach for older Americans. If you're over 70, haven't experienced fractures, and don't have a high fall risk, it's time to rethink routine DEXA scans. Rather than relying on a test that may do more harm than good, focus on natural, evidence-based strategies to strengthen your bones and prevent injury. Incorporate weight-bearing and resistance exercises, e.g., walking, yoga, light strength training. Get enough vitamin D and calcium through food and supplementation as needed. Practice balance and mobility training to reduce your fall risk. Stay physically active and maintain a healthy body weight. Before agreeing to a bone density scan, ask your doctor, will this change how we treat my health, or just lead to unnecessary medication? The bottom line for seniors: not every scan leads to better health, especially after 70. In many cases, routine DEXA scans in non-fragile older adults lead to overtreatment, fear, and unnecessary medication. If you're not actively falling or suffering fractures, there's a good chance you're better off focusing on lifestyle-based bone health strategies rather than pharmacological solutions. Talk to your doctor about whether this scan is truly needed, or whether it's just part of a one-size-fits-all approach that may no longer serve you. Why Americans over 70 should rethink routine medical screenings. Modern medicine has significantly improved life expectancy in the United States, but for older adults, particularly those aged 70 and above, more testing isn't always better medicine. In fact, overscreening can sometimes lead to unnecessary anxiety, risky procedures, and lower quality of life. That's why it's essential for American seniors, and their families, to shift from automatic checkups to individualized, evidence-based care. Before agreeing to any preventive test, ask your doctor. What exactly is this test screening for? Is there a real chance it will find something that can be treated effectively at my age? What are the potential harms of the test? Radiation, sedation, false positives, complication. If an abnormality is found, will the next steps improve my quality of life, or just lead to more testing and worry? Too often, older Americans are sent down a diagnostic rabbit hole. One test leads to another, followed by invasive treatments, even when the initial findings weren't dangerous to begin with. This approach not only inflates healthcare costs, it can also cause physical and emotional harm, especially when test results are ambiguous or misleading in older populations. It's time to put your health goals first. If you or someone you care about is over 70 and generally in good health, don't assume routine screenings are still necessary. Medical guidelines change with age, and what made sense in your 50s may no longer offer benefits in your 70s or 80s. Instead, talk to your primary care physician or geriatric specialist about your current health status and risk factors, the expected benefits versus risks of any proposed test, less invasive, safer alternatives to traditional screenings, your personal values and goals for aging. Personalized care, not a one-size-fits-all checklist, is the cornerstone of smart, safe aging. Stay informed. Stay in control. At a time when the healthcare system often prioritizes procedures over people, knowledge is your best defense. Making informed medical decisions doesn't mean ignoring your health, it means focusing on what truly matters to your well-being, independence, and peace of mind. If you're an American senior, or caring for one, subscribe to our free weekly newsletter for science-backed advice tailored to older adults, expert insights on when to say yes or no to testing, practical tips for navigating aging with clarity and confidence. Don't let outdated routines dictate your healthcare. Take control, ask questions, and choose a path that supports your values, not just your vitals.